50 million Americans are living right now with atrial fibrillation, or as many know it, AFib. It's an irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart-related complications.
There are procedures available to help patients maintain normal rhythm, and one life-changing method is accessible right here in the Mid-South. It's a unique procedure. It's done by Dr. Indranill Basu Ray at St. Francis Hospital, and he's here to explain how it works. Doctor, we thank you so much for being here. But let's just start off by sharing with our audience who may not be familiar with AFib. Is there a way to explain it that's pretty easy to understand?
Absolutely. So you see our normal heart beats between 70 to 110 beats per minute. Suppose you're running up a set of stairs, your heart would maximum go maybe 120 beats per minute. Mm-hmm. But the electrical system in the heart can sometimes go crazy, and you can start going between 400 to 600 beats per minute.
That sounds dangerous.
Yeah, absolutely. And that makes the whole heart go as fast as maybe 200 beats per minute. What this does is, one, it causes clot within the system, and that clot can be thrown into your brain, causing stroke. Wow. And as you know, most of the stroke, unless discovered early, it's almost untreatable. You have to put people through physical therapy and all, but there's no real medicine to treat it.
Is there a certain age group, a certain demographic that is more susceptible to AFib?
That's true. AFib is a disease of aging. The more a people ages, the more they're likely to have AFib. So it's said between 7% to 10% of people above 65 will have AFib. More than 10 to 15% of the population over 80 will have AFib. But unfortunately, nowadays we are seeing even younger people 49, 50, they are presenting with AFib.
And with that being said, and you mentioned exercise, when do you know that it's a problem? You know, like some people, if they exercise, it's like, okay, my heart normally beats fast. But when do you know, maybe I need to go to the doctor for this?
So whenever when you're exercising, your heart is supposed to go fast. That's a normal physiology. But if you're sitting doing nothing, watching TV or reading a book, and your heart starts going fast, you got to go to a doctor. And it is important to understand, if you do go to a doctor, if you get an EKG done, if that's normal, that doesn't mean anything. EKG is just like a picture. It shows what happens in that 6 seconds. In the next 6 seconds, you might have your heart going at 200 beats per minute. And that's why I have patients coming and telling me, I got an EKG 10 times in the last 10 years.
I'm fine.
I'm fine.
Right.
And unfortunately, we are present with a heart failure whose prognosis is worse than most cancers, actually. Wow. Though it doesn't sound that bad, like a cancer, or stroke, which is equally bad.
So tell us the difference between what is usually done for someone with AFib and a new procedure that you have decided in and is working for you.
Yeah, this has been there for at least 10 years now. So in 1997, we came out with a new concept in medicine, and this concept shows that inside the heart, the upper part of the heart, as you see in this video, are the pulmonary veins, which are blood vessels coming from the lungs to the heart. That has got muscular sleeve, where electrical beating can cause the heart to go as fast as 200 beats per minute. And so the technique we do now is go physically to these spots, as you can see, using a catheter system, and physically killing all those points which beat crazily at the rate of 400 to 600 beats per minute, and therefore control your atrial fibrillation. The problems with medicine is, we do have medicine, but they are not good enough for long-term treatment. A, they don't control AFib. B, you need increasing doses of the medication. And C, some of the medicine can be actually extremely toxic. So our medicine-wise, our choices are pretty limited. Whereas in this procedure, you treat the patient, you can get rid of the AFib. They may or may not require any medicine at all.
So this is more of a one and done. You get it done one time and you're finished.
Not really. And the reason is this. The procedure itself you can do once, but this part of the heart behaves like a lizard's tail. If you chop off a lizard's tail, it grows again.
Ah, I see.
So it might grow again, but 70 to 80% of the people will just need one procedure. Between 20 to 30% may need more.
The National Civil Rights Museum presents the 28th Freedom Award, honoring Gloria Steinem, Hafsat Abiola, and John Legend.